Hello, today we're going to talk about the minimum required skills of physical therapist assistant graduates at entry level. You've received a document created by the American Physical Therapy Association that kind of outlines the expected skills and competency of a new and entry level PTA graduate. So just a little bit of background here. In August of 2007, it was determined that this skill set and all these required expectations for PTA graduates be agreed upon and documented. So they were looking at all of the skills required for, number one, the NPTE, which is the National Physical Therapy Examination, and what would allow competency in a clinical environment. So this is what we're looking at when students go out to their clinicals as part of their program, but also as an entry-level PTA for their first job. So this document defines minimum skills, and you can read this as well as I will, but the foundational skills that are indispensable for a new graduate physical therapist assistant to perform on patients or clients in a competent and coordinated manner under the direction and supervision of the physical therapist. Now, something that a lot of PTA students don't realize is that all of the following systems can be addressed, and even more than these, during a PTA program and during an entry-level PTA position. Musculoskeletal, which is probably very obvious, neurological as well, cardiovascular, and a patient may have a primary cardiovascular diagnosis, but it also may be a secondary diagnosis or some sort of comorbidity that we need to keep in mind as we're doing rehab for a totally different problem. Pulmonary, we not only deal with pulmonary things directly in chest PT and breathing exercises, but again, also secondary to some other diagnoses. The lymphatic system is now considered by the APTA and FSBPT, who is the people that have the NPTE, the test, as a separate system. So the lymphatic system is now considered a separate system and is emphasized a little bit more. And so we'll learn about that more later. The integumentary system, which includes things like burns or wound care. Genitourinary system deals with pelvic health. So some of these are going to be new to some people. So we're going to look at several different categories of PTA skills that are required upon entry level. And plan of care review, procedural interventions, etc. You can read this slide, and we're going to go through each one individually in the upcoming slides. So the plan of care review is looking at that patient's chart. So there could be physical therapy documents and also separate medical records. So that would be in more of an inpatient setting, in a hospital, acute care, skilled nursing facilities, so that you're aware of some of these comorbidities that I spoke about in the last slide. So does that person have, cardiovascular issues? Do they have respiratory issues in addition to maybe that total knee replacement they just had? So we can't just, as PTAs, focus on the one item. We do have to look at the body as a whole and try to get as much of that picture of that patient through their documentation. Pertinent information. You'll have to look at what is important for you to treat that patient. So could it be that that patient walks their dog every morning, which increases their back pain? So the fact that they get back pain when they walk is important, but the fact that they're walking their dog may not be as important, right? So you need to pick out all those pertinent things as you proceed with that patient's treatment. You definitely want to know any red flags, any contraindications, any precautions, things that you can or cannot do to proceed with treatment. You need to be careful of certain things. Maybe this person gets dizzy when they sit up out of bed, so you need to work on that slowly, or possibly, repeat going from supine to sitting a few times until they get kind of accommodated to that. So something definitely that you need to pay attention to. Access to related literature. So that's going to be, you see it maybe a diagnosis that you haven't seen in a while, or you haven't really learned about since you were in school. And an important thing is, as a PTA, you're not always going to know everything, but you do need to know where to look it up. Okay? And identification of role in patient care is that, what is going to be your part in this patient's treatment? What is going to maybe be designated to you as opposed to the PT, or even to the respiratory therapist or the occupational therapist? And then identifying those things that you need to communicate to the PT, which is something we'll definitely go into more detail about. Procedure or provision of procedural interventions. And this is just making sure that you follow policies and procedures, that you're competent in providing the interventions that you are going to provide for that patient, whether it be exercise or manual therapy or some sort of modality like ultrasound or electrical stim. Assessment of patient response is vital here as well. So is that patient responding well? Are they responding negatively? Does a change need to be made? So not only recognizing if a change needs to be made, but how you're going to make that change. And clinical problem solving, as a PTA, you have to be able to think on your feet, and you have to think about a dozen things all at the same time, depending on the setting and who you're working with. But, again, assessing that patient's response and how you're going to deal with it is very important. Patient instruction. So a lot of what we do, most of what we do, is patient education. So how can they take care of themselves? What can they do after they leave the clinic or the hospital? What's important for them to follow through with? And using that variety of teaching strategies is important, because you're going to have obviously different types of learners, but also you may have different languages you're working with, or someone may be deaf, or someone may have kind of a low healthcare literacy competency there, so that you have to work differently with them. Some people you'll have to draw pictures for, other you may have to just write it out. So being able to be that flexible in that way to figure out what works best for the patient, and just being very, very clear in your instructions. Patient progression. So, to progress or not to progress, that's the question. So is that patient ready to move on to more difficult exercises, or to increase their weight with the exercise, or to do the treadmill a little bit longer? And sometimes there are psychosocial factors. Sometimes you have to be a little bit of a cheerleader when you do this. Okay, you know what? You're not going to be able to get out of the hospital until we can do, 3 sets of stairs, or until you can stand for 5 minutes. And so you got to give them a little bit of motivation. And again, here, clinical problem solving comes in, because this will be unique to each and every patient. Data collection. So data collection can be anything from measuring range of motion, manual muscle testing, doing special tests, checking someone's gait. Again, seeing how the patient's response to any sort of intervention. So this may be part of an initial eval, it may be part of a progress report, it just may be part of your daily note where you are measuring range of motion or something every time that patient comes in. Interview skills is being able to get the information that you need from your patient accurately, rather than saying, "How you doing today?" asking them, "So what is your pain level today?" So you can get something measurably subjective. Okay, and also then be able to take all that data that you've collected and clearly document it or communicate it to the PT as necessary. Documentation, again, we talk about relevant information, so you don't necessarily need to talk about, your patient having a 9-month-old Rottweiler, but that, the dog keeps her on her feet and has her go outside, things like that, things that are going to be important to that patient's treatment and progress. You want to be very accurate in your documentation. Starting as a new PTA student, we tend to go more for all the detail, but by the time you finish the program, you're going to need to pare that down to what's important. You want to make it very concise and succinct so that the next person that reads that note doesn't need to take an hour to get through everything that you've written. And that ability to adapt has to do with, in several situations, as a PTA, you're working with more than one PT, and each PT is going to want their documentation probably done a little bit differently or outlined in a certain way. So you have to be also flexible in that respect as well. Safety of utmost importance, and that goes from everything to how you handle the patient, to your equipment, to when you're walking a patient, getting all obstacles out of the way, being able to respond in an emergency. So if your patient all of a sudden is short of breath, or if they start holding their chest, what do? When do you call 911? When do you start CPR? And you do have to make sure that your CPR is updated and current. Healthcare literature, just being able to read and understand and just keep updated on healthcare literature. This is very important, as being a PTA is a lifelong learning process. And with education, not just doing continuing education on your own, but sharing that, with your colleagues, going to a course for a weekend and having an in-service to teach your other clinicians, but also in educating volunteers or aides, students, those students that have to come in, or prospective students that have to come in and do observations, and then community education, which we'll talk about in just a little bit more in a second. Resource management has to do with following policies and procedures and being fiscally responsible in that you are billing for what you do. You're not like, oh, they're such a nice patient, I'm not going to bill them for, gait training today or whatever. But making sure that you bill what you do, and then you don't bill what you don't do, exactly, right? Making sure your time management is good, that you are getting your patients in when you need to, and moving along with them. Behavioral expectations. This is definitely a whole other lecture. This has to do with the core values of a PTA and how we behave as PTAs. Being accountable, being compassionate, having integrity. And you can read about that in your handout, but also we will talk more about that in a future lecture. Communication, making sure that your communication is clear with everyone you work with, whether it be your patient, your PT, an aide, the front desk, and being able to manage any sort of conflict or any miscommunication, because that always needs to be clear and open with those that you work with. Okay. Promotion of health, wellness, and prevention. Again, not just treating that patient in front of you, but being able to promote health and wellness throughout the community. And we'll do a health fair in 5th semester, which gives you a kind of a taste of what that is like. And then I've already talked about how PTAs have to be lifelong learners. You have to engage in continuing education. You have to look at yourself and say, okay, what do I need, or what would be helpful in this setting that I work in? Always bringing in that new knowledge and exposing yourself to current knowledge. So that was a pretty quick overview of the minimum required skills. And as we go through the program, we'll definitely touch on more of these more thoroughly. Okay, thanks.